I would like to thank the organizers and also our CSI for giving us this opportunity to share our experience in partnership, which we are very proud of it. As you know, COSEXA, which already mentioned many times this morning, our main aim is on promotion of training, research, and surgical services. That's the three areas which we group regarding training. We work now in 12 countries. Remember, there are 12 constituent countries in eastern part of Africa. On top of these 10, Namibia and South Sudan have joined us. And in other 6 countries where we have a satellite training center in Central Africa. So the general concept of partnership is, basically, we want to increase the surgical workforce capacity. As we have said, we work on surgical workforce, improve the quality of surgery and exchange program with education materials and e-learning, distance and innovative learning program, and joint research. These are our main tasks in the college. The partnership in the college in Africa was many names, and during the First World War, the colonization time, so the name was used as partnership, but it's mainly on dividing and ruling our countries. But partnership has a potential benefit for the host, for us, primarily as for the reason which I have mentioned: increased workforce, institutional capacity building, access to resource from the host country. The potential benefit for the visitors, which was raised the win-win situation, is care in advancement, publications, professional intrigue. So these are the main, it's a win-win situation really. So we both benefit, and this is a mutual potential benefit which is going on reciprocal learning. But there are challenges in partnership. If it is driven by North partners' agenda, which usually called donor-driven, which are not addressing the problem of the recipient, then it will be a problem. Inadvertently contributing to brain drain, most partnership programs like sending young trainees to North America or Europe may have facilitated brain drain in many ways. If it is based on short-term training goal rather than long-term capacity building, then it has also a big benefit, a disadvantage for the recipient country, the host country. So we focus on areas of partnership. What we have to see is already said in different ways. Is it problem-oriented? Does it address the problem of the host country? Does it go with the policy of the host country? If you are going to against the host country policy, then we'll have a problem in implementing it. Does it need modification? You don't have to be stubborn with coming now. I am here to train non-medical doctors to be surgeons, no surgeons at all, but the country is needing the other way around. Then you have to compromise. That is, you have to be flexible when you come as a partnership. Training universities. Now we are training in the universities, also in hospital-based training. We have interdisciplinary or non-confined. There are areas which we have to consider when you train. So why do we focus on surgical workforce in our continent? 5 billion people worldwide, which including 93% of the sub-Saharan Africa, lack a safe, affordable, and timely surgical care. So the most important pillar to address is to work on surgical workforce. It's not only the countries need only. It's also the world has come in agreement with the Sustainable Development Goal. Out of the 17 goals, the Sustainable Development Goal focuses on health, and it says the three targets says good health and well-being. Sustainable. It has to be addressing all the health needs of the country. So this cannot be done alone. This has to be in partnership with other countries. So this is one thing we should consider as a country. Partnering is now a slogan of the continent. So we have serious shortage of surgical workforce, and also, but the disease burden is more in low and middle income countries. When you see the Lancet Commission has said 20% of surgeons, anesthetists and obstetricians, 20 are needed for a minimum of 20 are needed for 100,000 population. But this is not true in the world. When does this will be achieved? When we see more workforce are located in countries where there are no need for, or there are very less need for surgeries, but the bulk of the problem, the burden of the disease in Africa, where we have only 12% of the workforce. When we see in our continent, in the 10 COSEXA countries, which are close to 500 million population now, there are only 1,690 surgeons. And this makes like 0.5 surgeons for 100,000 population. When you see that. So does this has to be addressed, and how long does it take to come to solve this solution, these problems? It's not only the absolute number of surgeons, but the distribution. 85% of the surgeons are we are working on taking care of 15% of the population. So we have, in collaboration with RCSI, we have local organizations. RCSI is supporting our local organization, help us to scale up our ability, and we also have a cross-college collaboration. RCSI and College of Surgeons of East Africa are working together, and this is funded by Irish Aid for the last 10 years. This is now, we're not only dependent by Irish Aid, but we have been working also developing our capacity. Today, 60% of our expenses come from us. We contribute, we get, the college is contributing itself. So we are working to that extent. And we have working on collegiality partnership. We have a steering committee, which is about 50% of the steering committee are from COSEXA and RCSI. And the leadership, the training is, this steering committee is chaired by both colleges alternatively. So there are things which are already mentioned on how it works and how we have reached to this level. But now we have close to 500 trainees. And this year we're going to have 150 trainees are sitting for exam. As you see the graph, our training program is continuing. This shows a successful partnership which we have with Royal College of Surgeons of Ireland, supported by Irish Aid, and we are very thankful for having this genuine and very productive, which can be a lesson for many countries as a partnership. Thank you very much.